Good morning and welcome to the 2024 Spring Hybrid Medicaid Fair. My name is Talisha Hodge Thompson and I'm the Account General Manager and Technical Director for Gainwell Technologies. I'm absolutely thrilled to be here today and to extend a warm welcome to each and every one of you. The sessions that we have lined up today are nothing short of amazing, and I look forward to the discussions and the valuable insights that we're going to gain together with the sections. But before I go into the sessions, let me talk a little bit about some of the enhancements that we've done in the MMIS since our last Medicaid Fair. I also want to do an induction of our provider reps. I also want to talk about some key metrics and then provide you with some important links. The enhancement that we added to the system is the actions needed alert. This enhancement was added to our messages panel as well as our switch users panel. What this does is it gives the providers the ability to see their action items that require immediate attention. We will only show active action items. This will show at the top of the message panel in our web portal. When we're looking at the switch users panel, it's actually located to the right of the screen. If there's something that needs to be done, you will have a white indicator there. If it is, that means that you can click on the provider link, go back into that provider session, and then look at the messages and you'll see the exact screen that I showed previously. Now that I have wrapped up the enhancements, I want to introduce to you the exceptional provider relations team. They are the bridge between the providers and the MMIS. They ensure that we have seamless communications, effective collaboration, and optimal outcomes. The provider relations team of Georgia they foster the strong relationships between our providers and the agency as well as Gainwell Technologies. And without them, we couldn't do it. The reality is they have the determination of understanding and addressing the needs of our stakeholders, making them invaluable resources to us. And I appreciate everything that they do day in and day out. And I want to make sure that I give them their just due. So today I'm going to introduce to you our amazing provider relations team. Starting with Territory 1, the Provider Field Rep Services. North Georgia, Mercedes Liddell. Territory 2, DeAndre Murray. 3, Northeast Georgia, Carolyn Smith. Territory 4, Northwest Georgia, Tara Johnson. 5, Southeast Metro, Ebony Hill. 6, Middle Georgia, Chantel Bradshaw. 7, Augusta, Jessica Bowen. 8, Southwest Georgia, Jill McQuarrie. 9, Southeast Georgia, Kendall Telfair. 10, South Georgia, Anitris Johnson. Our South Hospital rep is Janie Griffin Weaver. Our North Hospital rep, Sharita Bentley. Moving on to our in-house support reps, we have Chastity Barrett, Crystal Gordon, Billy Guyton, Brandon Stewart, Kaylin White, and Latanya Durden. Moving on to our statewide consultants, we have Sheree Daniels, Brenda Hewlett, and Danny Williams. Our provider enrollment CVO field reps, Darlene Bonner for the South, Auburn Wood Hawkins for the North. And last but not least, we have our fearless leaders, the Claims Operations Provider Relations Manager, Anita Hester. And our Provider Relations Supervisor, Sharona Strong. Let's extend a warm round of applause for our incredible provider relations team. Now, I know you're saying, how would I contact them if I need to? We have an operation that will allow you to do that. That's through our web portal. Once you log into our secure web portal, you'll see under applications, all you have to do is click on web portal, as you see on the screens. Next, you will select contact information and then contact us. Then you'll get a drop down. And there's a number of options here, but you'll select either contact my provider service rep or request a provider rep visit. And that's how you contact our amazing provider reps. Now let me transition to some of the key metrics. There's a lot of key metrics here that's on the slides that you'll see today. I'm going to point out a few because, as you all know, we're going to provide this presentation by close of business tomorrow. So you'll be able to go back and look at the details that are located on the slide. But one thing that I'm going to start with, and this is basically all of the information I'm going to share with you, is from October 1st of 2023 through March 1st of 2024. The first thing I'm going to talk about is provider relations team, the provider outreach. We've done 7,582 provider contacts via emails, phone calls, virtual workshops, and virtual visits. As far as the provider contact center, we've had over 543,000 calls in the call center. We also have had 19,454 web portal requests. Moving on to our Georgia Families Unit, which is one of our other call centers. We've had 77,860 calls. And then as far as the written inquiry, we've had 43,837. Looking at provider enrollment, which is something that everybody's interested in. How long does it take us to process applications? Right now, we are processing our applications within 15 days of receipt, and the CVO is at 25 days of our 51-day SLA. That's awesome. I'm going to show you some of the stats, and I will encourage everyone to continue to revalidate. At the end of the day, we want to make sure that we get everybody revalidated so they can continue to process claims and service our Medicaid members. The CVO applications received 14,891, and we've approved CVO applications 12,660. Of course, you see a number there for non-CVO applications as well. The revalidation applications received is 19,566, and we've approved revalidation applications at 20,821. Now, I know you're saying, why is that number higher than the receipt? Because the reality is that this presentation is from the period of October 1st through March 1st. And the reality is that we would have received some of those applications in September. So that's why the received number is less than the approved number. Recredentialing, though, we have recredential applications received 6,227, and we've approved 5,554. As it relates to our resolution and adjustments, we are currently processing adjustments within 6 days, and we've had a ton of suspended claims that we've reviewed and processed, which equates to 56,650. As it relates to all the mailouts that we do in our data room and mail room, the number of outgoing letters mailed has been about 2.3, a little bit over 2.3 million. And then, of course, we have 10,804 number of publications mailed as well. A lot of information that we share today, a lot of information that's on the slides. But again, as a reminder, this presentation will be uploaded to our GAMIS web portal at the end of business tomorrow. And as it relates to the FAQs that we're going to have in the different sessions, they'll be available within the next 2 weeks. Again, if you want to see this presentation, please go to our GAMIS site, which is the mmis.georgia.gov. Click on provider information and then provider notices. Also on our web portal, we have the GAMIS banner messages. Those are messages that are available to you as a provider from the agency where they want to make sure that you have key and critical information that helps you do your job from day to day. If you want a DCH newsletter, that is available to you at dch.georgia.gov/dch-I. If you want to subscribe to that and be added to their distribution, you can actually do that at dch-I at dch.ga.gov. Before I take my seat, I will want to introduce the panel here because we have a great group of individuals here. So I'll definitely do that. But as I wrap up today, I want to make sure that it's important that we all take the inspirations and knowledge that we're going to gain today forward. Why is that? The reason we want to do that is because we want to fuel our collective successes and make a positive impact on our member provider as well as the providers. Right? The reality is we want to make a change. We want to make a difference. So I want to say thank you again for being here today. I am looking forward to the bright future that we're going to have together. And as a matter of fact, I want you to join all of the sessions that you're in today. And just remember to fuel your head with knowledge, because that's what we're here to do today. We want to make a difference. We want to make an impact, and we want to be the change. So thank you. But before I take my seat, I do want to introduce the panel here. We have Dr. Dean Burke. He is the Chief Medical Officer for the Department of Community Health. We have Lynette Rhodes. She is the Chief Health Policy Officer of Department of Community Health. And of course, we have Scott Stewart, our Executive Director, our newest member of the team, and we're great to have. So again, team, definitely, I appreciate you all being here. We're so excited. This is our first hybrid session of 2024, and I want to make sure that everyone virtually as well as in person are getting what you need. So basically, I'm going to turn it over today to Dr. Dean Burke for words for him.
I'm not going to be here long enough to clip this on. I'm just going to hold it. Yeah, you thought I had about a 30-page PowerPoint, but you're in luck this morning. Good morning, everybody. It's great to be at an event in real life with real people. I think all of you in the room would agree with that. It's kind of interesting that this group, I've spoken to a lot of groups, and it's amazing. You know, usually the back rows fill in first, and in this case, the front row filled in first. Now, some of those probably mandatory. You're doing your job. I get that part, but I don't see anybody with the orange cross looking like they don't want to be here, and so that's just a sign of the times that we're all people persons. We all enjoy the socializing, and my job here today is to welcome you from the Department of Community Health, and on behalf of our Governor Brian Kemp and Russell Carlson, our Commissioner, who was planning on being here but had an illness in his family and was unable to come, and here I am. So I think that the couple of things I want to mention. First of all, I want to thank the folks from DCH that are here. These folks at the table behind me, although it's always nerve-wracking to have people behind you, you know. In addition to being a physician, I was a state senator for 10 years, and you just have to watch your back in that world. So the thing that I want to bring home, and the reason that I became a member of the DCH team, is the passion I saw for trying to make Georgia healthier. And they do it without a lot of reward. You know, state employees, as everybody knows, is not the place to go if you want to get rich. But it is the place to go if you want to make a difference. And the state's health outcomes, as a physician who practiced in rural Georgia for 30 years, is not nearly like we want it to be. And one of the reasons for that, in my mind, is that we focus on what I call sick care instead of well care. And it came to me when I parked there, and I thought I was close to this meeting, and then I had to put in 1,000 steps to get back to this event. So, you know, being able to walk and not feel like you're about to have a heart attack is you know, it's a simple thing, but it just tells us sometimes if we did get short of breath during that walk, that maybe we're not doing what we need to do to take care of ourselves. And from the system standpoint, what I want us to do from the standpoint of the state of Georgia is to build the systems in place that would encourage people to take care of themselves, but have access to the services that they need when they're ill and need help that they can't take care of for themselves. And that needs to happen whether you're living in Donaldsonville, Georgia, or Habersham County, or Clay County, or anywhere else in the state of Georgia. All of our citizens deserve that kind of access. But DCH as an agency is a huge enterprise. I tell people all the time, I retired to this job so that I could spend $20 billion of other people's money every year. I mean, think about that. $20 billion a year we're spending in Georgia, give or take, on healthcare. Now, I'm not a CPA, so don't write that number down. It's an estimate, okay? But the group of people that are here with Lynette and Stuart Portman, who I'll introduce in a second, they're all dedicated to improving the systems that we have so that y'all can do your job better. It wasn't long ago I was the one telling my staff, why didn't we get X approved from Medicaid, and where's our paperwork, and why does it take you an hour to do X, Y, or Z? And all of those systems that need to be redone, we as an agency recognize that, and the governor and the legislature has invested a lot of funds for us to improve those systems. But unfortunately, those systems are so complex, it takes years to implement. It's not like at home where you can tear out your kitchen and be cooking again in 3 months. It takes years to implement these new technology platforms. And so I can promise you the future will be better when you're interacting with the agency. But right now you have to, deal with the systems that we have, but we have got great people to help walk you through that, and great partners with Gainwell and the other vendors that are assisting us in this journey for performance improvement. This year has been huge from the standpoint of the different projects that we've had to work on, the Medicaid redetermination that most of you are familiar with, that process of redetermining almost 3 million people for whether they're continued their eligibility. We have a procurement for the CMO contracts that's out in the field now, and the revalidation of all the providers that were mentioned earlier. All those things are huge projects in any given year, would be enough to keep us busy, and they've all hit in the same year. So when you are on the phone with our folks, give them a little grace, and know that they're there to try to serve you, to make your job easier. And I know that Commissioner Carlson wishes you the best in this endeavor to learn more about what we're doing. And we are here to learn more about what we're not doing that you think we should be. So I want to thank y'all for your participation. I want to introduce our new Medicaid Director, Stuart Portman. Stuart's been working at the U.S. Senate and Senate Finance in doing work in the healthcare arena for about 8 or 10 years, give or take. And he is very happy to be out of Washington, D.C. and just moved his family to Georgia last week. So, I'm just proud he made it through the 16 interchange here at 75, because I've lived here my whole life and it's still a struggle. But we're lucky to have him. We appreciate the fact that he comes with a vast amount of experience in healthcare policy, and we are going to try to teach him how to develop and put those policies into work on the front lines. And y'all are part of his education, is for him to hear from you guys on what you're dealing with in the field. So Stuart, I appreciate the fact that you've made the decision to come to Georgia, and we look forward to a long future growing together.
Good morning. See if that handoff of technology worked well there. Good. It is good to be with everyone, and I appreciate the kind introductions. And as always, we'll be learning a lot from Dr. Burke, from Lynette, and the rest of the broader team, as well as having had a chance to meet all of the Gainwell folks recently. But it is great to be with you this morning. I wanted to make sure, in addition to going over some general information, some priority issues, I also had the chance to sort of introduce myself to you so that as we discuss things going forward, as we build upon where we are today and figure out the best path forward for the future and make all those investments that Dr. Burke was mentioning, that you also feel like your lines of communication remain strong, because this really is a partnership. So as Dr. Burke mentioned, I am Stuart Portman. I previously worked in the US Senate. Prior to that, I hail from St. Louis, Missouri. I use that as a defense when people think I'm from Washington, D.C., but it is still not Georgia. But I have, after spending approximately a decade working on Capitol Hill, working as a senior health advisor, and for the last 7.5 years, working as the lead Medicaid and CHIP policy advisor in the US Senate on the Committee of Jurisdiction, which means it was my job to develop policy, work with stakeholders, have lots of meetings with providers, with patients, with anyone in the advocacy space, and actually work to draft legislation, finesse it through the process, understand what the cost ramifications would be. And so I come to this role with a lot of that policy background of what are the current debates and philosophical conversations around Medicaid. And I'm very excited to take all of that and put it into practice and actually start talking about what does it mean in the operations sense? What does it mean in the mechanics sense? And it has already been quite the education in the 7 weeks that I've been here, with a little bit of back and forth and a move last week. So you'll notice coming up that we're going to have a couple of polling questions. Some of them are going to be to make sure that we understand your experience with the vendors, with the CMOs, and a couple of them, you'll have to forgive me, they're for my educational purposes. So to make sure that I can learn more about Georgia from you. Underlying all of this, and while we always like to have as much fun as we can, there is this broader focus of why we're all here, right? And that is to put the patient at the center of our work. That is the guiding principle of what we do within the Department of Community Health. It is the guiding principle of why you serve the populations that you do. And the more that we can be partners in that endeavor, the better it will be for the patient population. And you'll hear that repeatedly today and going forward about how we put the patient at the center of our work. This is the mission of the Department of Community Health, shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. You'll see it multiple times. But we are going to jump to a poll. And that's going to require everyone to have a there we go. So if everyone can pull out their phone and type in menti.com, MENTI.com. There's a code at the very top. It's 17448103. It's up on the screen. I'll say it again. And for those of you that are joining us from more of a hybrid virtual setting, feel free to participate as well, of course. Menti.com and 17448103. All right. So the first question, because this is Georgia. What is the more quintessentially Georgia item? Peaches or pecans? Which I've been told I have to change how I say. This is helpful for me to get a sense from all of you, but I will say driving around Georgia, one of them stands out a lot more. Peaches looks like it's winning by a mile. Okay. Well warmed up, we're using the system. And once again, that code is 1744-8103. Oh, and we've already been adding to the next question as well. I appreciate everyone filling out the poll as we go. This is more, making sure everyone's getting a sense of activities we like here in the state. We've got the options of hiking, biking, and sitting on a beach. You all are providers. This one's pretty clear. You need a moment to relax. The next question, can you please rate your experience with Peach State Health Plan over the last year? I'd put this in the more serious category. And we use, this is real-time information for us to build on our work. Similarly, please rate your experience with CareSource over the last year. And please rate your experience with AmeriGroup over the last year. We have a more open-ended question because I am a big fan of dessert, which everyone has told me is a great reason to move to Georgia. And this one is perhaps a bit more selfish, but I appreciate the word cloud that is building as we speak to give me lots of options. Although as it's all growing, I am appreciating that home is still saying, competing with the Cheesecake Factory. So thank you, everyone, for the polling side. There we go. Thank you. We're going to jump a little more into going over some facts about Medicaid here in Georgia. And while I've tried to be as transparent as I can, that I am in for an education of my own, there are elements that I think it's useful for everyone to have, both for context and for you to know the people on our side of the conversation, which is the Division of Medical Assistance Plans. We have 146 employees in MAP. If any of you are in the room, if you can Stand up, raise your hand, make yourself known, just so those can recognize you. Thank you. That's right. Those employees that are dedicated public servants are spread across 4 different offices, units of MAP. They are eligibility and enrollment, performance and care management, policy, compliance and operations, and service delivery and administration. And while Dr. Burke also mentioned the size of the budget, it is worth us knowing broadly that when we talk about the world of Medicaid, whether it's low-income Medicaid and the work through CMOs, whether it's Peach Care for Kids, we're talking about the more fee-for-service side of Medicaid. When you add it all up, combine the federal and state sides of this, Georgia's Medicaid program is approximately $18 billion just within the Medicaid side of DCH. That is massive. That is huge. I can tell you that both from an on-the-ground perspective. I can also tell you that having, had one of those roles where I looked across the country and saw all the different programs. Georgia is a massive program. And that also means we have a lot of room for opportunity. We have the ability to make sure that our health outcomes are guiding a lot of the decisions that we are making. As part of that broader effort, we have a lot of steps that we can continue to take. One of which, and while it is ending, has been the redeterminations effort to make sure that people are landing in continuing to have coverage where they can, if they are eligible for that coverage. And while this has been a large effort, I just want to continue to emphasize the fact that we have had such a large change in enrollment in the state of Georgia. Over 1 million additional beneficiaries have been added over the course of the public health emergency. It is the largest eligibility redetermination ever, both in Georgia and nationally. It has never happened that we've had 3 years of continued eligibility and having to do all of those redeterminations at once. And while that has been spread across these past 12 months, it is very important that we have the ability to make sure that as we work with our DHS and DFACS colleagues, as we work with our community partners, as you as providers are working with your patients to make sure that they're enrolling where it's appropriate, we are nearing the end of this immense effort. And it is exciting to know that people are going to be able to be in a more regular cadence of their coverage so that we can get back to what are more normal operations within the Medicaid program at large. It requires a lot of focus. And while this redetermination effort began on April 1st of 2023, we can say that by the end of this month, we are on track that everyone in the program will have had their renewal initiated. That process can continue. It can take some additional time to complete. That is for a variety of reasons. It can take additional time to send back renewal packets, go through the applications. There's a 90-day window to make sure that those renewals can be confirmed, and there's the potential for an appeal. So while you're going to see a lot of numbers and dates thrown around over the next few months, we are really at the beginning of the end of the redeterminations process, so we can move into those normal operations, focus on that performance improvement and all of those systems changes that Dr. Burke was mentioning, and get back to the operations that allow us to focus solely on the care and the outcomes of the populations we serve. This has been a large effort. You all have been a part of it. There have been reviews, enrollment, re-enrollment, in-person events, calls, texts, which is actually a newer element in Medicaid, as antiquated as that may sound, but it has been hard. It's required lots of changes to be able to make those conversations happen as seamlessly as possible, to meet people where they are, to help them go through these processes, both actively and through an ex parte inactive basis of checking other eligibility systems. And we've all played a large role. Providers have played a large role. Plans have played a large role, and we really appreciate everyone for stepping up. Just to give you a little bit of data, and you'll learn this as we continue to work together, is that I'm a big fan of making sure that you have data as much as possible. This is a sense of our entire population for enrollment from the start of the public health emergency to November of 2023. This does not include the SSI population. That's a little harder on the tracking side, but these numbers show that we had a large number of individuals. It went up rather dramatically, and we still have and retained a large percentage of those that were enrolled throughout the PHE. Specifically, again, to give you some numbers, through November of 2023, about 71% of those that became enrollees during the PHE are still active. One other important program to mention that has started during this time would be the Georgia Pathways to Coverage. It's a new program as of July 1st, 2023. You all should have seen a lot of information about it, and you will continue to see a lot of information about Pathways. It is an eligibility-based program, and the eligibility criteria are that it is for individuals up to 100% of federal poverty line that are not otherwise eligible for Medicaid. It is for those between 19 and 64 years of age. They must be citizens, and they must adhere to qualifying activity standards. Those include full-time or part-time employment, on-the-job training, job readiness assistance programs, community service, vocational educational training, enrollment in vocational rehabilitation programs, or other higher education. So an 80-hour per month standard. That is a program that is going to continue to grow and be an opportunity for more people to have coverage extended to them so that they can make sure that their Medicaid coverage can continue. And we can use all of the help we can get to make sure that your patient populations are aware that this opportunity exists and that they might be eligible. So please take note. There's information that is already has been sent out on the banner side. There's information that has been sent out more broadly. And if you have any questions, we are happy to make sure you have what you need to help share this with your patients. And this wouldn't be a conversation if I did not join as the third person up here to say, let us make sure that we talk about provider revalidation. Confirming your status is incredibly important, and we can use your help. There are things that we can do as the state and that we are actively doing. There's a lot of work to make sure that we are reviewing any system that currently exists that we can use to make this a more seamless process. There's a new interface with the Medicare PCOS system. Other systems are being reviewed to help make sure the revalidation process is as seamless as possible. CMOs, MAP, everyone is sending notices, there are emails, there are texts, there are calls to revalidate, but ultimately we need your help as a provider for you and to share with your colleagues to make sure that the revalidation occurs, especially when there are individuals with multiple locations listed as a site of service. You can help clear up a lot of that confusion so that you are able to process claims in as efficient a manner as possible, which is ultimately the goal. And now, right before we wrap up, I want to share a few provider fast facts. This is a lot of data that is very small, but there is one broader point because this is sharing the number of providers and the percent change between October 2021 and September 2022 and October 2022 and September 23, both for the CMO side and for the fee-for-service side. So I find this information very interesting. One of the takeaways that I think is helpful, and see what you can see here, is that overall, we've had either increases or broadly stable provider participation in the Medicaid program, which is fantastic. It speaks to the strength of our providers. It speaks to the strength of our shared values for caring about patients. And I would also note that Georgia's pretty unique. It's not to say there are not workforce issues, but when you have a workforce issue because of the population growing, that's a challenge we can tackle. A workforce issue because your provider population is leaving, that is a huge concern. And we are fortunate that that is not the issue here. But we can use your help to make sure that we are understanding what it is that you face day to day. You can share it with us formally, and many of you do. And you can share it with us informally so that we have the ability to keep your actual experiences at to help inform and guide the work that we do with the populations that we serve. So this last slide is just to give a sense, sort of a heat map of where our providers are. I don't view this as sort of a positive or negative because it's primary care and it's based on the providers, number of primary care providers per 1,000 members. And obviously in some of these areas, there are just more members. So if it looks like it's a bright red, it doesn't scream an alarm to me. It's at least yet. It's more to say this is a sense of where our providers are around the state. And we have the ability to help focus a little bit more of our work. The final thing I'll say is that in Medicaid, broadly, we frequently forget to do something very important because of how dedicated we are, regardless of where we sit. And that is to tout the successes of the program, to push back against any sense of stigma and make sure that we actually acknowledge the things that go well. It's very easy to focus on the things that are difficult because we have to bear with them day to day. But here in Georgia, the level of provider engagement is high. When there are issues that arise, no one hesitates to reach out. And I know from our team, that is viewed as a really positive attribute because it helps us identify issues the minute they start. We also know that when members have questions or concerns, they get answers right away. Those questions, it can come in through Gainwell. It can come in through a case manager. It can come in through our CMOs. But that is a very, very important element of how we are able to engage our population and make sure that when there is a concern or a question or a difficult eligibility issue, that we can help to solve it as efficiently as possible. There's a heavy focus on quality improvement, and you'll hear more about that in the future. That's a way to incentivize everyone to join future Medicaid fairs. And we also want to make sure when we make changes that we are transparent, that policy proposals as they come about, we are sharing them quickly, that they're going up on banner, that you're hearing about them through as many means as possible. And it gives us a sense of being able to focus on the future and make sure that while we are working to improve the program and looking at data to understand where we are today, that there is a vision that allows a healthier Georgia to be the focus, and all of us together can be a part of that goal. So thank you all. I appreciate all of your time and for bearing with some of the technology side of it, and look forward to talking to you in just a few more minutes about a few of our newer initiatives that we have going on in the Department of Community Health.
Thank you, Dr. Dean Burke. Can you hear me? Thank you, Dr. Dean Burke. Thank you, Lynette Rhodes, and thank you, Stuart Portman, for being here today. Again, we are glad to have all of you all with us today. We appreciate you all being here. We have some great sessions planned for this long day, but I know we're going to enjoy it, and it's not going to be long at all for us. So I am looking forward to everything that we have available to us. And as far as the sessions, do you guys have the sheet for me? Just want to bring it to me? So we have a number of sessions planned today. Of course, this is the opening session, which we just did. We have the new initiative slated for 9:55 to 10:55. And then we have the Peach State at 11:05 to 12:05. Mental health is at 11:05 to 12:05. DOS telehealth enrollment is at 11:05 to 12:05. We also have Care Source from 1:15 to 2:15. Revalidation and COI, 1:15 to 2:15. Common denials, 1:15 to 2:15. AmeriGroup, 2:25 to 3:25. And member redetermination pathways, 2:25 to 3:25. So those are all the sessions. And if you need someone to give you additional information, please reach out to anyone that you see with a tag on. They can definitely assist you. Also, someone left their phone in the women's bathroom. Not sure if it's. I have it and I'll give it to you. I'll give it to you then. Thank you very much. Again, thank you all for being here. We appreciate you being here. We are excited about our future in the state of Georgia. We have the #1 Medicaid program in my eyes, and so I know it's in your eyes as well. And we want to continue to make it better for our members as well as for you. And so thank you again and have a great day.